Looking at the young, beautiful babies and highly energetic mothers, it gives us a lot of energy. 4 or 5 pediatricians, we sit together, we cry.
Cry like babies.
Cry like babies and take our attentions. But we love our field. Don't stop working, because if we go to home, we'll become big nuisance for our wives.
Children are essentially small adults coming in different packages.
You will be surprised, this year there were 2,800 fire accidents which have damaged eyes.
Children are not responding to antibiotics as they should.
Our country right now, again, a disease called tuberculosis is coming back with a bang. Repeated use of sanitizer can cause skin cancers on the long run.
Hello and welcome to Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. Today we are diving into a very crucial topic that every parent should know, that is infections in children. I'm sure we all got stressed about this at some point or the other in our lives, and let's know more about this. Welcome to the program, Dr. Ramesh, and it's such a pleasure to have you on our program.
Thank you so much.
So Dr. Ramesh, with more than 4 decades of rich experience in this field, what does it take to establish yourself as a successful pediatrician? And what are some qualities do you think that one should possess to excel in this field?
I don't know, ma'am. You probably the parents and the grandparents now, because this is my 44th year in pediatrics and my 50th year as a doctor. So with age, probably we are getting old. Our hormone levels also are coming down, so we are not getting angry now. Because the parents, sometimes questions will be endless and very, very tiring, but I don't get angry anymore, because I know, because I'm actually a multiple grandparent now. I know how much concern you have about kids and their problems. So maybe the most important thing I developed over 44 years is patience, and of course lot of experience with different types of it. Sometimes everything is not like what it is described in the books. We have a lot of variations. That comes with experience. Youngsters may have more bookish knowledge than us, but sometimes experience also counts.
Yeah, so you have the practical experience more than bookish.
Practical experience, that's the thing I can.
I think that's rightly said. So I'm sure dealing with kids requires immense energy and patience. So where do you find this motivation or driving force coming from?
No inspiration, ma'am. I do exercise a little and look after my health. But looking at, when compared to other fields, I'm not blaming the other fields or anything. You say every field is challenging, probably is same. But looking at the young, beautiful babies and highly energetic mothers, it gives us a lot of energy. A very, very sick child, within 1-2 days, again with treatment, they'll be completely normal and they'll be smiling at us. So much energy it gives us. So looking at all those babies, probably we are also remaining like kids.
Yeah, I think children are like, miracles.
They are miracles. There's no second doubt about that.
So doctor, where do you find this energy practicing so actively even at this age? What's the secret mantra? Please tell us.
Nothing, ma'am. No. Secret mantra is nothing. Always, ma'am, be older doctors. The basic thing is we are all a little disciplined. But we don't stop working, because if we go to home, we'll become big nuisance for our wives. Anybody? We are all saying that, adamant people. So that's why it's always better with the parents who respect us and go back and stay at home. So that's why majority of the older doctors, they don't retire. Just joking, man. I do a little yoga and we keep managing.
So Dr. Ramesh, do you believe that children are essentially small adults coming in different packages?
Children are definitely, nowadays, you won't believe it, ma'am, even 3-4-year-old kids, when compared to when I was starting practice about 45 years back, they are really, as you say, they are mini adults now. Their IQs are going up, the way they behave is going up. And I think probably they come up, but the majority of them kids are always kids. And sometimes even parents are kids.
Yeah, I think it's vice versa. So you've definitely seen a different era, like how children used to be and now.
Children are actually, probably because of very early exposure to social media, and they are looking at lots of videos. This what you just said, that the so-called child is becoming a mini adult. They are maturing very fast. They are more exposed to what is happening. We can't fool them around. For example, if a 7-year-old comes and says, how did I come into the world? We cannot tell him that the stock has brought you home. So they are more inclined. They are more inclined now. So we also have to adapt according to that.
So sure, doctor, I understand, when you're dealing with children, parents are equally stressed. So it's like you're treating the entire family at the same time. So how do you tackle this situation?
Not entire. I would slightly like to correct you, ma'am. It's not entire extended family. For example, a newborn baby comes to me. The anxious parents, the so-called maternal grandparents, and the anxious also paternal grandparents. So 6 people all firing different questions at you. We have to tackle all of them without getting irritated. And sometimes the same question will be in 3 different sets they'll be putting you. But that is what is pediatrics, ma'am. Sometimes we enjoy it. Sometimes we all, for example, 4 or 5 pediatricians, we sit together, we cry. But there's, in fact,
Cry like babies.
Cry like babies and take our attentions. But we love our field.
So now that we are post festive season now, back to back we had Diwali, we had Christmas, New Year, recently Pongal. So do you think, we also see that kids are falling sick post festive season. So why do you think this is happening, and what are some common issues that you face?
Yeah, the first festival was Diwali, ma'am. The winter festivals, Diwali, Christmas, and Pongal or Sankranti, or in different regions, it's different names they called it. In the north, they call it in a different way. In Diwali is one festival which, even though the government and everybody, all the people are discouraging the use of crackers, but that will not disappear. Even very inclined parents, very inclined mothers, they still buy crackers because I don't know why. It's not exactly the pressure of the children, but they also probably like crackers, even though it's not written in our shastras or whatever you call it. And you will be surprised, this year there were 2,800 fire accidents which have damaged eyes in SD hospital reported just the next day of Diwali. Because that fire sprinters, they come, children, they cannot close their eyes suddenly. And they'll be burning some crack. Even the simple, that sparkler which you hold, that can come and get into your eye, and the cornea can develop a ulcer. So it's not a festival, and even though we tell the parents to see that in case you have to burn crackers, let the child wear a mask, so that phosphine gas or whatever, that noxious gas and that dangerous gas which comes from burning crackers goes into your wrist, or the sparkles, wear a zero glasses or whatever you can saying over the specs. Nobody listens. So these are some of the bad things. And you know about air pollution, how Delhi has stopped crackers, but nobody is going to stop. So these are some of the bad things, that is the bad effects on the lungs and eyes for children. Then coming to Christmas, of course, that is mainly the winter problem. Christmas is a festival where luckily we don't have any snow and all that in Hyderabad, so we are much better off. But still, around that time, the air becomes so dry that during Christmas time, the dry air is not good for lungs generally, unless some amount of at least about 15 to 20% moisture is there in the lungs. So during Christmas time, that is during late December and early January, children have a lot of respiratory infections. All children who have little bronchitis, or we call them asthmatics, all of them, the disease flares up during Christmas because of the dry air. And of course, a lot of viruses also are prevalent during Christmas. And the third thing is that child will be very irritable because the skin goes dry. That is also because of no moisture. So especially infants, the mother has to keep on putting some moisturizers on the thing so the skin does not get dry. And the last festival, probably much better off than the other two festivals, is so-called Sankranti or Pongal. But one accident-prone festival, Sankranti, is because of these kites. And this year, you must have read in the papers, they were using a new type of thread. We had a lot of accidents coming to my clinic. Children, when they saying the new type of thread which is coming from this, they call that manja, the so-called Chinese manja, they call that. That's a nylon thread which, if you leave it from the hand, it immediately cuts the finger. A lot of children had these finger cuts. By chance, if it gets entangled into the throat, then the child had it. Really? In fact, it cut the throat for some people. There were some accidents where the people who were going on the road on scooters also, the thing got entangled in the throat and they had accidents. So these are some of the bad things about festival. So the parents have to sing and enjoy the good parts of the festival.
So, doctor, recently there was news that children are not responding to antibiotics as they should. So, what does this exactly mean? I mean, is something that we should worry about?
100% true, ma'am. In fact, children are not responding because of injudicious use of antibiotics. Please remember that in our country or throughout the world right now, every month, we have a new virus with a new name, with a new Chinese name or a new some Japanese name or something. So 90% of the respiratory infections or the fevers are viral. In viral, if we, without any secondary infection, if we use an antibiotic, it's not going to respond unnecessarily. The resistance in the child will go down and the child will develop resistance to that particular antibiotic. So injudicious or unnecessary use of antibiotics, sometimes you can't blame the doctors also, ma'am. The doctor may have written what happens. I'm not blaming the parents, but what happens is in our country, you can buy any drug anywhere in any shop without any prescription. I don't know when the so-called government is clamped down. You cannot do it in any country. Some of the countries like Sri Lanka and even in Bangladesh, you cannot buy a medicine without a prescription. Only in India you can get it. So we give a prescription for some fever or some cold and cough. The mother next time mild virus comes, she will repeat the prescription again. So the antibiotic goes on until that the poor child develops a total resistance to that drug. So whether it's due to ignorance or the mother is trying to treat on her own because she has some, she's not able to come to the doctor. So please don't use antibiotics on your own.
Without consulting a pediatrician.
Without consultation and without the doctor prescribing that after a good checkup.
Yeah. So talking about resistance, doctor, there's also another myth where we tend to believe that if the child plays in the mud, the child develops immunity and that's good for the health. So is it true?
See, what I think this is not maybe not very true in our country, ma'am, where we spit out left and right. So playing in the mud, always you please remember our country right now, again, a disease called tuberculosis is coming back with a bang. It's coming back with a bang and there are a lot of resistance germs. And we Indians, especially ones who have little phlegm, they won't wait and go to a bathroom and spit it out. They'll be spitting left and right. So playing in the mud is okay in the West because they are not exposed to any mild, even minor bacteria and the little germs which are in the mud. If they go inside, that definitely increase the immunity of the child. But we, without anything, breathing our air in India itself will give a lot of immunity, Dr. Lakshmi. You need not go and play in the mud. In fact, by playing in the mud, and if he puts that mud inside his mouth, there's always a chance of some man who has no manners who has spit there and that germs going inside. I would not advise parents to encourage them to go and play in the mud at all. Unless it's their own house and nobody is going to come there and then I don't know.
So talking about sanitization and also talking about some preventive measures, how to prevent infections. So what are some measures you think that we as parents can inculcate in our children as habits so that to avoid these infections?
Actually, you'll be surprised, ma'am. Actually, even myself, I've got 4 grandchildren. And 2 of them are, we call them the COVID babies. And they were born during the COVID time. So they are so disciplined. In fact, I get nowadays 1.5 years. Now again, slowly the people have relaxed. A 1-year-old child, they'll wear mask. They'll be wearing a mask in the clinic without tampering it. They won't touch anything because the mother, if they touch anything, also the mother will give such a look to the baby. The baby will immediately take out and push karne, they put the sanitizer and say. So children, generally, the parents are training them into such that they are more, I would say, disciplined and organized now. And please remember that this using sanitizer is not at all good, ma'am. It's also a chemical. And always they say that repeated use of sanitizer can cause skin cancers on the long run. And therefore, the baby's skin is very, very delicate. So you should not. Washing the hands is okay. So for example, they have come to a public place where a lot of people have put their hands. Always better to wash the hands, but not
so
use
washing your hands
sanitizer.
with soap and water is always
Soap
better
and water
than,
is always good.
better than using a sanitizer. And finally, Dr. Ramesh, is there any message that you would like to share with our viewers out there?
Nowadays, majority of the parents, when compared to our generation and when compared to my children, and we see, I'm a 70-year-old. So when compared to my sons and the next generation, mothers are very, very smart now. And I don't think they will take any advice from me. They're very smart, very smart. In fact, 95% of the mothers, if at all any mistake they are making is because they are very busy. So the problem sometimes they are so busy with their work that they tend to ignore the children, and at that time the small accidents come. And recently I've been seeing a lot of small accidents because in India we don't have a thing called accident proofing of homes, which is within all the Western countries. For example, a baby, we call them the terrible twos. If a child is 1 year old until he completes 3 years, they are very highly accident prone. For example, there's a plug on the lower side, they'll go and put a finger into the plug. So if you have not put a dummy plug in that, that's the fault of the mother. Any, for example, a cable is there that should not have a sharp edge, because the baby will fall and will slip and fall on the sharp edge and cause very major accidents, sometimes losing an eye. So you're all smart, you know about how to prevent infections. You'll keep the child clean, you'll give the best water, you'll boil the water and give. That part I need not tell you, but don't let your child go into an accident. So that part you have to look after, because still I'm seeing lots and lots of accidents in small babies which could have easily been avoided.
Especially at a safe environment like a house.
Exactly. In homes only.
Yeah.
All the accidents occur in homes.
Correct.
When they are outside, the mothers are very alert. They will catch the child and they will not. At homes, they relax and they will be working of their housework, because majority now this work from home business. So the mother is busy working from home and the child goes here and there, and by the time it's too late, they'll be watching. And they think that the child is safe because they are in the room, but they are not safe.
Another common accident which we encounter is choking or ingestion of some foreign body, which we see.
It's very, very common, ma'am. Very common. In fact, we get a lot of this thing, especially during the winter season when we have a fruit called sitafal. I think it's called custard apple in English. This custard apple seeds are long and very smooth. The child always likes to play with that in the mouth. And the custard apple seed, if the slightest choking, it easily goes into the windpipe. And very common cause for massive choking. If it goes beyond, then it's okay. But then bronchoscopic removal and all that, it's a very big process.
Well, thank you, Dr. Ramesh. It
Thank
was
you, Dr.
wonderful
Lakshmi.
interaction.
So nice of you asked so beautiful questions.
Thank you, sir. So this brings us to the end of this episode. Hope this episode was informative and it cleared up some concerns and gave you some insights how to manage few situations better. And don't forget to tune in next week as well. Until then, take care and stay healthy. Thank you. So this brings us to the end of this episode. Hope this episode was informative and it cleared some concerns. And remember, staying informed and working closely with a pediatrician makes a world of difference. Don't forget to tune in next week as well. Until then, take care and stay healthy. Thank you.